Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Gout, and we're looking at its classification. So the first variety will be the primary gout. So in terms of the primary gout, it is by the unknown enzyme defects. So this amounts to about 85 to 90%. So what about the uric acid production? The uric acid production, it can be high. So uric production, it is slightly high in terms of majority of the cases. This is the uric acid. And looking at the uric acid excretion, it is normal. This is most common what is seen. Next, in minority cases, there is a severe increase. This is in minority cases. And there is increase in the uric acid excretion. Next is where there is a normal. In normal, there is a decrease in the uric acid excretion. Now let's move on to the secondary gout. This secondary gout, it amounts to about 10%, and the clinical category is there is increased nucleic acid turnover. Increase in the nucleic acid turnover. Example being the leukemia. Now, what is the uric acid production? Uric acid production, it is increased. So this is in terms of the increased nucleic acid turnover. Example leukemia. So here the uric acid production is increased, and the uric acid excretion, if you see, this is also it is increased. Next, let's look at the chronic renal diseases. The chronic renal diseases in the uric acid production, this will be normal, whereas in terms of the uric acid excretion, this is going to be reduced. This is the uric acid excretion, it will be reduced. Next, let's look at the other category, that is the congenital. So by congenital, we mean syndromes such as the Lesch-Nyhan syndrome or the HEBRT deficiency. So in cases like this, the uric acid will increase, whereas in chronic renal disease, the uric acid production was normal, whereas in congenital diseases like this, it is going to be increased. Then the uric acid excretion, if you see, it is going to be increased. To learn and grow daily like this, please do subscribe.